Hello, dear students of my September batch. Welcome to the webinar. I hope my voice is audible for everyone and my screen is clear, so we can start.
Hello, Dr. Mehwish. Yes, you are audible and your screen is visible too. Welcome to the session.
Thank you. Welcome everyone to the session. So, as everybody knows already, that this session is about the guidance, about the steps after getting the results. So first thing which I'm very much sure about is that the students will handle the results very positively. If they pass the exam or if they fail the exam, in both cases, they will handle it quite with the positivity, as I know our students are prepared so well. They were doing a lot of hard work. All right, we are live now. Okay. So it's actually the time of getting the fruit of your hard work, and the October 18th, if I'm correct, October 18 is the day for the result. Okay, right? On October 18, we are getting the results of September batch, right? Anyways, yes, okay. Welcome, Dr. Mustafa, to the webinar. So what we plan to gather all the students of September batch here, and we plan to talk to them. We plan to uh, listen to them. What are they feeling and what are they planning next? Because MRCOG is a 3 steps examination. If you clear all 3 of them, you get the degree of MRCOG. So we can start with Dr. Mustafa here. Dr. Mustafa was with us, and he was a wonderful student of September batch alongside his duties and work routine. He was preparing so well, and the thing which I appreciate more and more, that he was helping a lot of students in his study room as well. So Dr. Mustafa, what are your feelings at this time? Are you anxious? It's natural, you can just share the feelings with your friends. Okay, Dr. Mustafa is saying that he is a bit anxious, and that's natural. That's natural. Being anxious is a bit is totally natural, but I'm very much sure, Dr. Mustafa, and all the students who were studying with us so well, they will pass the exam. So let us start with our today's presentation, which is again after getting the results of September batch. So if you all, okay, Dr. Abdullah Mughal wants to ask a question, please. Yes, Dr. Abdullah. Dr. Abdullah, you can just turn on your mic and you can speak as well. Okay, I'm waiting for the question. I think Dr. Abdullah has raised the hand. It means that you want to ask a question. Anyways, so if this is your state at this time, I've told you that it's quite natural, and feeling anxious, feeling nervous, feeling bad about your preparation, feeling bad about the questions which you marked wrong, it's quite natural, because we discussed in our motivation session that the feeling can be unexpectedly negative. It can be difficult for you to tackle the situation, but you will keep on going. So whether the result is making you happy, the happy face which is on the left side, or it's making you sad, because we, yes, Dr. Abdullah, you are raising hand. Please ask the question. Okay, you can write down the question in the chat box. Okay. All right. So whether after result you are the one who is on the left side, or after the result you are the one on the right side, you you have something, you should have something on your mind that this is not the end of this world. Either you pass the exam or you don't. It will not be the end of this world. It will not be the end of the journey of MRCOG. It will not be it will not label you as an MRCOG, and it won't label you as you can't do this or you can't qualify this exam in your future. So, with a lot of positivity, let's move ahead. I have shared the results of med exam pass percentage before, and I have told already that med exam has a very high passing percentage. So, why I am very much sure that all of our students will get the high scores and they will pass the exam. But I'm sure because of the track record. So, you can see that over the years, med exam gave brilliant students uh, to MRCOG exams. And last year, it was an 86.2% passing rate. And this is assuring, this is relaxing for the students as well, that they are with an organization, they are with a batch of mentors who are having wonderful results and wonderful passing percentage over the years. So in their exam, definitely I'm expecting that we will get around 90% pass ratio. So what is the point of discussion today? What to do and what not to do after getting through the exam? If you have qualified the exam, so what you will do? So let us ask Dr. Jyoti. Dr. Jyoti, what will be the first thing which you will do? Uh, Dr. Jyoti joined, I guess she's not here with us. She is with us. Okay. Dr. Jyoti, what will be the first thing you will do after getting the results and you will pass the exam? I'm quite sure. Then what you will do? Out of
Mm,
happiness, out of excitement.
I will join. I will start studying for MRCOG Part 2.
Wow, wow. You have got a lot of motivation. I guess you are the perfect example for other candidates. Actually, I was talking about the celebration and party and anything like this. So, okay, you will join the part two preparation, but after doing a lot of party, because
Yeah.
no doubt, if you have cleared the part one, that means you have taken your first step of becoming a MRCOG, which is your dream, which is a dream of every OBS gynae specialist. And okay, the first step is right in front of you. You will party quite hard, and while partying, you will be thinking about the next step, and that is very clear that your next step is taking MRCOG two. So we will discuss when you should take MRCOG2 and when you should start preparation for it, because circumstances will be different for everyone. It's unlike part one, and with time we don't find exams easier. With time, you will see that exams are getting hard. They are getting different. Hard means it will be different. It will be a different structure than MRCOG one. So you will be thinking about the next strategy, the next plan. So what we can offer, what I can offer, that you just make a call to MedExam customer service, make a call at my number, just discuss what you want to do next. Because when you will discuss, you will get new ideas, you will get perfect strategies for your study plans, and you will get motivation for the further steps also. Because coming steps are difficult than the one you have already done. So you will discuss work-related challenges because mostly part two joiners are working in hospitals. They are working in gynae and obstetrics mostly. Part one candidates are different than part two candidates. So when you are working, you will be having less time for study. So I will give you the strategies. I will give you the tips for preparation of MRCOG2 alongside your work. So what will be those strategies we will discuss on the phone, or we can plan that we can schedule the discussion sessions with our students who are going to take MRCOG2 right after MRCOG1. So I've told you already, I'm talking about point 4 now, that part 2 and 3 are completely different than part 1 of MRCOG, and you should keep this thing in your mind that cramming the keys, doing the past papers, and just thinking that you will clear this exam eventually will not will not be a successful strategy for the part 2. And students ask a lot of time that what is the required time for the preparation of MRCOG2. So I would say that 4 to 6 months of dedicated preparation is enough, 4 to 6 months. But again, I will tell you, if you are working in Ops Gynae department where you are following the guidelines for part 2, it will be very easy for you to prepare the exam, but it will be difficult for the ones who are not working or who are fresh joiners of Ops Gynae. So circumstances are different for all the candidates. So what are the bad ideas which you don't want to follow? Mafia, what do you think? We have seen a lot of students over the years, and we see that some students they delay their part 2. So what happens with them? Mafia, can you please explain? Is it a good idea to delay the part to attend the part 2 or to start the preparation of part 2 after like 2 to 3 years? Is it a good idea?
Yeah, actually, Dr. Mehwish, but I think that it's vary from students to student to student, na? Because few of the students are like they have different caliber. So what I think that part 2 should be given like within 1 year, I guess, or 2 years. It should not be delayed as well because all the studies fresh in their mind. So that's why I recommend students to just give their part 2 exam as soon as possible.
As soon as possible. Yes. So Mafia has said that actually our team is communicating with hundreds and thousands of students daily. What we see and what we experience after seeing the circumstances of students, we share with others also so that they can benefit from the experience of others. So what we have seen over the years that delaying the part 2 preparation will cause nothing, but it will delay the whole process of becoming a MRCOG. And the other mistake which students do, they start preparation without a proper guideline. Without a proper timeline, without a proper guideline, both things are very dangerous because I have told you that you have, and after passing the MRCOG, when you have entered into the MRCOG journey, but completion of this journey is as important as being entered into. And another important thing which I want to tell you is this, the very important thing. Students, again, they do not plan, they do not ask for guidance, and they plan or take the part 2 exam so quickly. Like if you are passing the exam in September and I was receiving the messages of Mehwish, am I able to attend the part 2 exam in January? So I just asked, are you prepared for it? Oh, what is the preparation? Please, can you tell me about the books? So if you are so motivated about taking the exam in 3 months and you don't know about the books, you don't know about the pattern, so exam is not like taking a mock exam and just guessing that what questions they can ask and what kind of MRCOG 2 questions are. This is not the way you do with the post graduation exam. You attend them after very good preparation. So taking part 2 so quickly or taking part 2 very late, both things are both things will complicate your journey of med exam. So I'm introducing you all with the team of the med exam. You can see all the mentors. We have the wonderful CEO, Mr. Hassan Haider with us. And you can see Dr. Zaid, Dr. Hassan, Dr. Hilmi, Dr. Pradnya, Dr. Maryada, all of us are part of this team, but in MRCOG2, the main senior mentors are Dr. Hassan, Dr. Zaid Qureshi, and Dr. Pradnya. So if you join the med exam for MRCOG2, you will be having wonderful time with our most senior and most hardworking mentors. So I have given you some introductory points for the regular course of med exam for MRCOG-2. Just like MRCOG-1, we have live session, we have study groups, we have recordings of the sessions. All important summaries will be provided. And again, you will be having support of senior mentors alongside. And then you'll be having flashcards for the revisions, topic tests, like you were solving the topic test in MRCOG-1. So practice questions are very important for MRCOG-2, and questions specifically for the practice of for practice and memorization of the TOEFs or the guidelines. Then we have very extensive mock exams. Then now we have introduced a very important workshop in our courses, which will make you prepare for the exam right before the exam. So the people who have attended the workshop in the September, I will just see if someone, yes, Dr. Shabreen Seher is with us and she has attended the workshop. So she can tell you the importance of attending the workshop right before the exam. It's actually not a part of our course. It's actually provided just before the exam, just to make you prepare all the important topics which they ask in the exam quite often. So, Dr. Shabreen, can you please tell us how was your experience with the workshop, with med exam, with the course, everything? And I am introducing Dr. Shabreen as the top candidate of our September batch because she was giving wonderful performance.
Hi, ma'am. So actually, it really helps, like the workshop. It's a very, how to say, combined approach. Initially, we have these live lectures and we have like this basis of information already. And based on that, you're going to solve a lot of questions. And the workshop adds to the entirety of the portions. Like it adds to your knowledge, as in it helps you finish up those particular topics. Like a question, when it comes, you're not just finishing the question, you're going to be finishing the entire topic. And so you have like say 1,000 topics covered, and
1,000 topics covered,
it's such
yes.
it's such a wonderful thing to have like a last moment revision, and it really helped a lot. Thank you, ma'am.
When I was okay, thank you so much, Dr. Shabreen. It was very comprehensive and explanatory answer from your side, and thank you so much. Actually, when I was discussing the theme of the workshop with Mafia, who is a senior team member, I was discussing that the timings of discussion of these topics is very important. If you have read or if you have discussed the same question three months before, and right before entering into exam, you don't revise it. That means you will have a higher chance of making mistakes in the exam. But if you revise the same things before entering into the exam and you clear your concepts 5 days before the exam, that's a wonderful thing. And I was just thinking that when I was student, why I didn't attend the workshop like this. So it's a real blessing that med exam has organized the workshop in the last week before you enter into the exam. And it makes our students very confident because they really know that they have covered 1,000 important questions right before the exam. So the same workshop will be a part of the course of the MRCOG-2 as well. And it is organized by Dr. Zeeb Qureshi, and I've already introduced Dr. Zeeb Qureshi as our senior mentor. She is my mentor as well. And she is a wonderful person. In the whole world, I have never found such modest, such qualified, and such cooperative person in the world. Dr. Hassan, you already know that he is the examiner for MRCOG exams as well from RCOG. So joining a platform which is giving you all the successful and all the qualified mentors, it will assure you your success in part 2 as well. This is what I'm trying to say. What's the other side of the story, that there are successful candidates, but there are some unsuccessful candidates also. So I have plans and I have strategies for those candidates as well. So what to do and what not to do after an unsuccessful attempt, this is also a topic of discussion. So firstly, your positive attitude will matter a lot. After getting an undesired result, after you say, I won't say that you have failed the exam. I won't use this word for my wonderful students who worked so hard, and they were just losing a few marks in the exam. And I know this is totally hard luck, but this is again not a failure, not a failure. Unless you want to try it again, it's not a failure. So I will just say that this is an unsuccessful attempt, and this is just it is just a step of your journey, because difficult things happen after a lot of hard work. So sometimes the part of this hard work is that you don't get desired results from an exam. So what happens? You can see I have shared this motivational quote here that fall down 1,000 times, stand up 1,001 times. No matter how hard your life is, keep fighting. So I will just pray that nobody from the med exam students and everyone who has taken the exam, nobody experience such thing. But there are some certain reasons due to which you can disqualify this exam, and they those reasons are fixable. You can fix those issues. You can correct the cause of the disqualification. You can you can correct the root cause because of which you couldn't just clear the exam. So what will be the steps you need to take after you don't get a desired result? The first thing is that no, that failure is not a label for you, and you can resit with more preparation. Okay? You can always resit in this exam 7 times. I won't recommend you to take the exam for 7 times, but if some strategy was not working previously, you will just change it and you will just fix it, and you will take the exam later after some months. So it will be a matter of just 3 to 4 months preparation. It won't label you a fail person. It won't label you a person who cannot clear this exam, and it won't label you as a person who has not done the hard work. Actually, it's all about changing the strategy, changing the attitude towards the study, towards the exam. Again, get the guidance and advice from education experts and mentors. Med mentors, team is just one call away. Just call them, just discuss your next plan, just discuss that what are you thinking about. This is a We will help you identifying your weak areas, and we will help you working on those areas more, and we will help you getting successful results in the next attempt. So Mafia, will you share the previous experience of students with us that um, they were having a lot of you know they were doing a lot of struggle, but they couldn't clear the exam, and after joining the med exam, after taking the right steps, they cleared the exam very well. We have a lot of
Yeah,
students
Dr.
like
Mehwish,
this.
I have a yeah. Is there anybody who wants to talk else?
I think there is
Okay.
a doctor who wants to talk. Yes.
Yeah. Yes.
Anyways, you keep going on. We will listen to
Okay.
that doctor as well.
Yeah. Okay. Well, I think I just remember there is a long list
Hmm.
things in my mind, like students who message us like the 70% of their exam was according to the preparation from the, especially from the workshop, I guess. So I can share even the reviews of the students who have just like after the exam they have shared their reviews. Just give me 5 minutes, you can continue, I'll share the reviews so that our students shall know that what were their words.
So what I was telling you that we deal with challenging situations a lot of time. What is a challenging situation for a mentor? For me, a person is challenging who is working a lot, and he is not getting enough time for study, and he has the kids at the home and a lot of family responsibilities, and he is taking exam again and again. He is not getting the reason why he is failing the exam. So what I will do to that person? See, we are doctors. We deal with challenging patients as well. We try one strategy after another. We give one antibiotic for dealing with the infection and then we give other, unless we get the results. So as a mentor, as a teacher, I come across with such cases, with such difficult and challenging students. And what I do, I I just try out identifying the cause first, the root cause. Firstly, I identify the cause. I help students identifying the causes of their failure. Then we work on making a timetable. Then we work on discussing their availability, and then I provide them the right and exact study material which they have to follow. Actually, it is from all the mentors of the med exam, and then there is no chance of disqualifying the exam. So if you don't get the desired result, in that way, you can just follow the steps which I have told you. You will talk to me, you will talk to the med exam team, and we will identify the weak areas. We will identify the reasons of the failure. Mainly the reason of failure is wrong concepts and lack of time, lack of the work, which is which is required for passing the exam. If someone is working for whole day and when he's coming home and dealing with the kids and the family responsibilities, he will be having only 1 hour for study, and that 1 hour is actually not enough. So that person is not a failure in his life. That person is just so busy with other tasks that he is not giving enough time for the study. So we can, we go to the dietitians and they give us customized plan according to our routine. So in this study, it's the same thing. We should get a customized plan from an education expert when we can't fix something for ourselves. Okay. And after disqualifying one attempt, you should take the next attempt within 6 months. Within 6 months. Do not delay taking the next attempt, because here your knowledge will already be sufficient. You just have to polish some of the areas, and you just have to fix some mistakes. And what are the things which you need to avoid after disqualifying an attempt? Do not start preparation with the proper guideline. Faulty study methods. Faulty study methods should be left behind. What are those faulty study methods? You are not opening the books. You are only relying on the files of the recalls. You are cramming the keys of the recalls, files which are available. You are not confirming the keys, the answers with the mentors, and you are not getting updated material. You are not getting updated material. You are reading the um, old and discarded books by some writers. So if there is any faulty study method, just change it. Okay. Again, I can help you identifying your faulty study technique, and then we will think about the solution. After after getting the result which was not desired, you will not think that MRCOG exam is too difficult for you. MRCOG exam is not difficult for any person who has done the MBBS, who has got the medicine degree in his hands. MRCOG exam is the next step. That's it. It's not difficult for you to clear. Okay. Following a lot of social media groups and ending up getting nothing. Mafia will again guide you about this. That team, med exam team is again, I'm telling you, dealing with a lot of students. And when we see someone who is following a lot of social media groups, he will end up getting confused in building up the concept, because one mentor is saying something can be different from the other, and this way he leaves the important things behind, and he ends up thinking about the confusing questions all the time. Confusing questions are quite little in the percentage. In exam, they only ask 6 to 7 confusing questions, 6 to 7 controversial questions. They just want to, get a knowledge. I guess the students get confused between these two options or not, because the pattern of the exam is single best answer. So if there is a second best answer, they want to check if you pick up the second best answer or not. So for some mentor, the second best answer is primarily important. For the other, the answer which is actually correct is important. So following a lot of mentors, following a lot of social media groups, and trying studying a lot in a lot of places. Again, it's high. I highly discourage it. Follow one platform, follow one media. What do you think, Mafia?
Yeah, exactly. I totally agree with your words, Dr. Mehwish. Before that, I would like to show them some reviews from our past
Please.
students for the September batch, especially. So I just want to share your screen. You can share your screen again.
All right.
So here are some reviews we have posted on our page as well, just to encourage them. So we have the one review from Dr. Nahida. She was saying that it was awesome. It increased my confidence. Question setup was too wise. Thanks a lot, our mentors, to arrange such a nice workshop. It was the review from your workshop. And we have more reviews as well. So the other one is like from Dr. Dina. Thank you, Dr. Mehwish.
Dr. Dina is with us in
Yeah, still she's with
the
us.
session as well.
Yeah.
Okay. Thank you,
She
Dr.
will
Lina,
attend.
for this wonderful feedback. And I'm
Yeah,
quite
she's
happy that you
Yeah.
attended the workshop and you got the best out of it.
Yeah, she's saying this workshop is a gold standard for the students. So many questions came as such, and I remember your explanations as well. I'm so grateful and hopefully for good success, inshallah. Prayers from all. Please, we need it. Awaiting for the result. You can see that we have so many wonderful, feedbacks from the students. There is a student, Dr. Nora. I wish I joined early this course because I take only $199, but all the recorded lectures was so good.
Wow.
Yeah, we have so many reviews. I can't read all of them, but few of them I will read, because just to let students know that how was the workshop, how was the course actually. Because obviously the main thing,
Yes.
the main purpose of sharing these feedbacks, Dr. Mehwish, is that obviously we all are doing a lot of hard work to earn the money. So I don't want that they should know that the right platform, because I don't want their money should get wasted. So that's why I'm just reading so that they can decide wisely what they have to choose.
Yes, and mostly we have the students which are already part of our September batch, and this time they are choosing us for the
Yeah.
next step. So, Mafia, will you announce a very handsome, very good discount after the session?
Yeah, exactly. Actually, we have just our organization decided that we have 50% off for our course students on progressive course, on the regular course of July batch as well, and 30% off for the attendees of this webinar. It's like for 24 hours, so students can join us as soon as possible.
Okay, and again, you have got this opportunity of calling us at any time. Just discuss. If you are feeling anxious at this time and you want to talk, we are here. We can talk at this time as well. So what I want to show you is, Afia, can you please send me the discounted slide again so I can show it to the students as well? So we are here. We are here for a good talk. We are here for giving a guidance. We are here to give you strategies. We are here to uh, give you next plan. So all of us are studying happily. Either you get the desired result or not. We will be working on getting better. We will be working on getting good results. And we will definitely succeed in this exam. If you have, I'm saying good luck to all the students. And if you have any question or you want to ask to me or from the team, you can discuss it with me.
Hello, ma'am. How are you doing?
Hello, doctor. I'm doing great. How are you?
I am doing also fine. I have a question regarding something.
Please, you can ask.
Okay, ma'am, me and my friends just finished our preparation, but we still feel we are behind preparation. So, can you help us with this?
Yes, why not? You and your friends. And can you please tell me how many years of experience you have got in obstetrics and gynecology? 1
Ma'am,
year, 2 year,
almost 4 years.
almost 4 years. That's great. You are a perfect candidate for taking MRCOG exam. So you are preparing for January exam, I guess so, right?
Yes, ma'am. Exactly.
Okay. So for January exam, we have a very perfect revision plan. At this time, a lot of students are already preparing, and they have you know uh, they have got they have got the books, they have got the SPAs, and they have got everything in their hands already. But what they need a perfect revision plan. So we are talking a lot about the workshop at this time, but we have a 6 weeks progressive course as well. So if you and your friends join that course, that would be very helpful. You just keep on studying and you enroll yourself into the crash course or the progressive course, and I can guide you about it, that it will be 6 weeks duration. It will cover all the chapters. Uh, we will give you the recordings of the live sessions which we have covered in the regular one. And after playing the recording and after reading the topic from the book, you will have a live session on 1 or 2 subjects with the mentor. It will take 6 to 7 hours for one session to be finished. And then what you will do, you will do the revision of that subject in the same day. So this way, the preparation, I know at this time you will be feeling anxious about your preparation, and this time you are not sure if you can take the January exam or not. But after you enroll yourself into this study plan, which I have told you, the progressive course, Mafia, you have given the detail of the progressive course in. Okay, Mafia is giving you the details of this progressive course as well. So, okay. We have another question from a doctor. So just you, after you finish your doctor, I will answer. Dr. Rehab, I will answer this question right after Mafia finishes the introduction of this study plan. Yes, please.
Okay. Yeah, Dr. Mehwish, before explaining the progressive course, I just want you to explain, tell them why the revision is important. Because
Yes.
I think that the revision gives students an opportunity to reflect that what they have learned. Basically, revision is a way they have just a way to learn about the craft of learning. Actually, so we have just give an opportunity to the students just to revise their all this study material under the guidance of the best mentors, which are Dr. Helmi, Dr. Mehwish. They all know you very well. And then we have Dr. Desri. So what we're going to do is we'll give them the recorded lectures of all the modules, so that if there is any, if they think that their concepts are not cleared yet, they can revise it in the recorded lectures. After that, we have
Great.
given them, after that, we have given them the opportunity that once they have revised the module, let's say it's anatomy, it's pharmacology, they have revised it, then they can discuss all the details, or even if they have any query, they can discuss it in the live session with their mentors. After that, we will provide that flashcards as well for the quick revision, and the study group as well for the intense discussion. Once they will discuss all the modules with their and revise all the modules with their mentors, what they're gonna do is after revising every single module, they will attempt a topic test. After that topic test, they can discuss it with their mentors. Once all the modules are done, they will perform a mock exam. After the mock exam, once they're done with all the modules, then we'll go with the workshop. They, in the workshop, they can discuss important exam like questions, like which we can recalls as well with their mentors in the study group. After the recalls, we will take one big mock again. So it will help them to prepare their exam, and they will pass their exam in one go with this kind of preparation. Because as you can see this
Yes.
image, yeah, this is what they actually need. With the revision, they need a support. They need past papers as well. They need their concepts to be clear. The main thing on which they have to focus is, one is their knowledge, second is their past papers, third is their support from the mentor. They don't need to go anywhere. There is everything is available here under the umbrella. So they can what you have to do is they just have to join the course and just start revising and just start preparing for their exam. So
Okay,
for the
Mafia has explained it so well. I guess Dr. Abdullah is following the whole plan, and this is the best explanation that why revision is important and why revision is so promising for getting the best results in first attempt. Yes.
Yeah. So for all our students who are attending, who have attended already our course, so what we are offering, that we have offered them 50% off on the progressive course. So they
Wow.
just, yeah. So they just got talk to the team. We have shared the number in the chat box as well, and just start their preparation now. We have the course is starting from 20th November. If they have any query, they can ask us on the Facebook page and even in the chat box as well. So
And
this
this
is
is
the
for the January students.
yeah, this is for the January students, and
Yes.
even if the September student want, they can join us as well. But few of the students were asking me for the July batch as well. So what we have, like we have given the discount, 50% discount on the regular course as well as on the progressive course. For all the students who are already the part of our course, they can get the updated courses on 50% off, whereas the attendees of this webinar can get the courses, both progressive as well as a regular course. They can get it on 30% off.
All right, this is amazing and wonderful
Yeah.
offer. And
And if they
Mafia, you
still
will
have
keep
any,
on no, you will keep on sharing your slide because now this is the time for question and answer only. So we have a question from Dr. Rehab. Dr. Rehab is asking, ma'am, I have a very tight schedule. I'm preparing for July batch. Okay, you're preparing for July batch. With 2 kids and a full-time job, what would you recommend? Shall I proceed with this same speed or just preparing in January or July exam? So what I have got from this question, that person is having a very difficult time with the studies and she wants to take the exam and she's unsure if she should take the January or the July. Dr. Rehab, it is your own choice that which exam you want to take, January or July. You just start your preparation. From today. Mafia, we can offer a good discount to this student as well because she is having a tough time at her home and she really needs an organized study schedule and an organized study material so that she don't get lost in searching the correct answers in the books. And we know that there are old versions of the books available in the market, and I really don't recommend any student to read them at home and get confused between a lot of wrong concepts which are given in those books. So, Rehab, what I would suggest that if you want to take the January exam, that means you have to put a lot of effort into study. And if you want to take the July exam, then there is a study plan in which we have the recorded lectures already available, so you can get entered into.
Yeah, I think she need a schedule with a slow pace. She wanted to start with a slow pace. So I think for her, July batch is a very good option, July exams, because she can
July
go with
exam is a
us.
good option, yeah.
Yeah, because she's saying that she is struggling with the, her job and kids as well. So July batch, I would recommend her because she can get the July batch right now because we are offering 50% discount for 24 hours. So Dr. Ahab, you can take the July exam. I will provide you with the organized schedule according to your, daily routine and all that. Okay, thank you.
Is there any other question from the side of the students? again, all the attendees of the webinar. I wish all the best for you for the results. You will share the results with the team of the med exam also, and we will discuss the results further. In both cases, what you have to do, I have guided you in every possible way. I hope the webinar was informative for you and it was useful in terms of getting the guidance, because after getting the results, if you are happy or if you are not, you need to take the further steps. You just can't sit somewhere and you just can't wait for some miracle to happen. For part two, you need discussion and guidance, and you need a proper study plan. And if you are unable to qualify this attempt, that means you have to retake the exam, and that for that thing again you need guidance and you need discussion, and we will again discuss the study plan. So in both cases, I just wish the disqualifying the exam, it don't happen to anyone. But I just wish that if you get the undesired results, you just stay strong and you just stay positive. And we are together here. We will definitely qualify the exam, because med exam is the most trustworthy organization for especially those students who are struggling with taking multiple attempts. I won't just name them, but students sometimes share their feedback and they tell you that we were studying alone or we were studying at home, and then we joined the med exam, and then we got our concepts cleared, and then we cleared the exam after 3 or 4 unsuccessful attempts. So I don't say that it should happen to anyone from our September batch, but if it happens, there is always a support, there is always a help, there is always a further plan. So just be very hopeful about the results. I'm again doing a lot of prayers for all the students. So Baka, we should terminate the session also. So is there any question behind we can discuss, or if there is no question, we can just terminate the session?
Yeah, Dr. Mehwish, I would like to send my best wishes to all the students who are waiting for the result. Wish you a very best of luck because they have worked so hard. I would say that med exam expert will always be there for all of you. If you need any kind of support, if you need any moral support, if you need any support regarding to your studies or anything you want to discuss with us, our mentors, our backend team, our CEO, Mr. Hassan Heather is always available. So just click a message. We are on your site. Thank you very much and wish you very best of luck for your exam. Thank you. Bye-bye.
Okay, bye-bye.